Welcome back to the Physician Gardener, where we discuss all things health and wellness. My pre-video disclaimer is that I am a doctor, but I am not your doctor, so please consult your personal physician for any health-related advice and before you make any changes based on something you saw or read on the internet. Now, this video is for educational purposes only, and let's get into it. So today we are going to do pillar number 2 of our lifestyle medicine series, and that would be physical activity. So physical activity is any movement you do with your body that expends energy above baseline. That there's a difference between physical activity and exercise. So exercise is purposeful. Hold on, let me get the exact. Exercise is purposeful physical activity that is organized, planned, and recurring. So in general, I ask my patients how much do they exercise, and about 50% of people will be like, oh, I exercise all the time. I'm on my feet all day at work. That is not the same as exercise. That is physical activity because it's something that you're doing, but it's not purposeful movement that's getting your heart rate up and that you're doing for the purpose of increasing or improving your physical fitness. Because fitness is the outcome of exercise, and you have your cardiorespiratory endurance, your muscle strength, muscular endurance, body composition, balance, flexibility. All of those are part of fitness and generally are not improved just by being physically active at work. I also tell patients that if you are not getting your heart rate up, like if you don't feel like your heartbeat is going faster, then you are not exercising. Although arguably yoga is exercise and doesn't necessarily get your heart rate up, but that's because it's more flexibility and balance. Whole other story. We're not really going to get into that today. So, how much should you exercise? Well, the national exercise guidelines that show improvements for the most improvements for in terms of your health and longevity would be 150 minutes of moderate intensity exercise spread over most days of the week, or 75 minutes of vigorous exercise spread over most days of the week. So the difference between low, moderate, and vigorous / high intensity would be that low intensity exercise, you can talk and you can sing and do whatever you want to while you're exercising. Moderate intensity means that you can talk, but you cannot sing. High intensity or vigorous means that you cannot talk. We recommend spreading your exercise over most days of the week. So ideally, it would be at least 4 or 5 days a week, although I do understand this is not possible for some people. So doing it whenever you can is always the best option. Some exercise is better than no exercise. During your exercise routine, it's recommended to do a mix of aerobic and strength training plus balance and flexibility. Most people will do some form of aerobic exercise. And if you are doing that, then it's just recommended to add in 2 to 3 days of strength training each week as well. If you are starting a new exercise program, it's always best to start low and go slow, meaning if you are not a person who exercises, do not go out and try to all of a sudden run 30 minutes every day, 5 days a week. That's just not going to work for you. You're going to give up really quickly and you're going to feel really bad if you are even able to do that. You probably not last 10 minutes if you all of a sudden decide to be a runner. So start low and go slow, meaning start with low impact, low intensity exercise. Go slow by starting with maybe 10 minutes or 15 minutes and then build yourself up as your body tolerates it. Don't push your body to extremes that are not sustainable or effective for you. You can do this by setting fit goals, meaning deciding what frequency, intensity, type, and time of exercise you're going to do. For instance, if you are new to exercise, one thing you can do is say, all right, I'm going to exercise starting out 3 days a week for 15 minutes a day. I'm going to walk and I am going to, that's all of it. Okay. So I'm going to walk 3 days a week at low intensity for 15 minutes. That covers the frequency, the intensity, the type of exercise, and the time. So any type of fitness goal you set, you can break down into that type of formula to help you stay on track. And better yet, if you pick which days of the week you're going to do and what time of day, then it makes the goal more specific. And more specific goals are usually more likely to be achieved. Now, why do we want you to exercise? Am I just making this up saying that you should exercise, or are there any actual benefits? Oh, are you exercising just for weight loss? No, not at all. The benefits of exercise include improved sleep, improved brain function, including concentration and memory. It also includes improved mood. People who exercise on a regular basis have lower rates of depression and anxiety. Exercise also lowers blood pressure. Exercise improves insulin sensitivity, meaning it lowers your risk of diabetes and metabolic syndrome. It also decreases your risk of heart attacks, strokes, and your overall risk of mortality. And most of these benefits are seen even if you do not lose weight with the exercise. I know a lot of people will say, well, I've been exercising and I haven't lost any weight, I'm going to give up. But regardless of whether you're losing weight or not, maintaining a regular exercise routine improves your overall lifespan and quality of life. Quality of life is something we want to maintain across all phases of the lifespan. So that's all for today. Leave your questions and comments in the box below. Don't forget to like, comment, share, and subscribe. Hit that notification bell so that you are aware when I post new videos. And don't forget to follow me at The Physician Gardener on Instagram.